Dear students, thank you. And before I start my class, I again pray to Almighty God for your healthy life. And today we will take class, especially the question of Chittagong University on genetic disease as well as poisoning. Already we have finished respiratory system, cardiovascular system, endocrine system, infectious disease, nervous system, and blood disorders, rheumatology. These 7 systems we have completed, and today we will complete 2 systems. So 9 systems will be completed before your Eid vacation, and after Eid vacation we can continue the rest classes, and within next 5 days, 5 classes, we can complete the written question. And after that, we hope to take class on Viva question, and later on, according to the planning given by principal, next class schedule will be taken from next month. And today, our first question on poisoning. A 20 years old girl admitted in medicine department with unconsciousness, profuse salivation, and her pupil is constricted. What is the most likely diagnosis? Our most likely diagnosis is OPC poisoning, organophosphorus compound poisoning. And second question was name 4 clinical signs in favor of your diagnosis. And the clinical signs are bradycardia, hypotension, muscle fasciculation, retention of urine, and convulsion. Our next question was give the outline of treatment of this patient. And general measures of OPC poisoning: airway clearance by suction, breathing by oxygenation by high flow oxygen, circulation by IV fluid, and prevent contamination by removing the contaminated cloths. And gastric lavage if patient come within hour of ingestion, catheterization, intake output chart. A specific treatment: injection atropine 3 ampoule IV stat, then repeat 15 minutes interval up to full atropinization. And here the signs of atropinization are dry mouth, dilate pupil, tachycardia. And injection diazepam is sometimes given IV if convulsion present. Injection ceftriaxone can be given if suspected infection, especially respiratory tract infection with fever and dyspnea and cough. Injection pralidoxim, it is the nicotinic receptor antagonist, usually given 2 gram, that is 500 milligram 4 ampoule IV about 4 minutes to combat nicotinic effect of OPC. 4 ampoule IV slowly over 5 minutes and repeat after 6 hours if needed. So this is the answer of question number 1. Now the question number 2. A 30 years female presented with history of snake bite. A 30 years old female presented with history of snake bite 3 hours back. Write down the clinical features of this poisonous snake bite. The local features: pain, site of biting, bite mark, local swelling, bleeding, ecchymosis, blister, necrosis of the local tissue. And systemic features: non-specific features: headache, nausea, vomiting, occasional convulsion. And the neurological effect are ptosis, and it is the first presentation of or complication of snake bite, ptosis, and respiratory muscle paralysis. Vascular effect: bleeding and disseminated intravascular coagulation. Cardiovascular effect: hypertension, cardiac arrest. Musculoskeletal effect: generalized muscle ache and muscle tenderness. And kidney complication: oliguria, anuria, and AKI. Now, treatment of a snake bite patient. First of all, first aid. Immobilization of the affected limb to prevent an envenoming. Pressure bandage can be given. Maintain ABC and support vital organ. Injection TT, tetanus toxoid, and tetanus immunoglobulin to combat tetanus. Send the patient to nearby hospital for further treatment. And in hospital, we have to maintain ABC, airway clearance, breathing, and circulation. Then injection antivenom serum IV with injection adrenaline subcutaneously to combat shock, anaphylactic shock prior to venom. And for AKI, renal dialysis, hemodialysis can be given. For respiratory support, we can give mechanical ventilation, IV fluid to combat shock and hypotension. And monitoring of the patient blood pressure, pulse, oxygen saturation, and urine output. The good effect of the antivenom: it can reverse DIC, it can reverse the neurotoxicity, and prazosin to combat hypertension, and follow up after antivenom therapy of this patient is needed in hospital. So this is the treatment of a poisonous snake bite. Now question number 3. A 40-year male presented with dyspepsia, anorexia, nausea, vomiting following ingestion of aspirin. What is your clinical diagnosis? Our clinical diagnosis is aspirin poisoning. Name 2 other factors give the same type of poisoning. One is paracetamol poisoning, and next is NSAID poisoning. How we can manage a patient of aspirin poisoning? Gastric lavage by activated charcoal if patient come within 1 hour. IV fluid to correct dehydration. Injection sodium carb to correct metabolic acidosis. Urinary alkylating agent when salicylate level of blood is more than 500 mg. Hemodialysis is also effective in renal function, effective in renal failure. Now question number 4. Describe acute cholinergic syndrome. It is a clinical presentation of OPC poisoning which occurs within few minutes of ingestion of OPC and it is characterized by frothy salivation, confusion, bradycardia, hypotension, retention of urine, muscle fasciculation, convulsion, and constriction of the outlined the treatment. Airway general measures: airway clearance, breathing by oxygen inhalation, circulation by IV fluid, gastric lavage if patient come within 1 hour, catheterization, maintain intake output chart. And a specific treatment: injection atropine, 3 ampule IV stat, and repeat 15 minutes interval up to full atropinisation. Injection diazepam, injection ceftriaxone, injection flurridoxime. Write down the complication of OPC poisoning. First of all, seizure. Second is intermediate syndrome. Intermediate syndrome, it occurs within 1 to 4 days of exposure, and it is characterized by weakness in the ocular muscle, and the weakness also is spread to head and neck muscles and the proximal muscles of the hands and respiratory muscles, leads to respiratory failure, and it is treated by supportive treatment by ventilator. Now question number 5. A 25 years old female admitted in medicine department with history of ingestion of your 30 tablet, and each tablet contain and 500 milligram paracetamol. What are the clinical effects you expect in this patient? Two toxic effects, one is hepatic failure, another is renal failure, can develop in this patient. And mechanism of hepatotoxicity: toxic intermediate metabolites of paracetamol normally detoxified by glutathione of liver, but excess metabolite causes liver injury due to inadequacy of glutathione. Now, treatment of paracetamol poisoning. General measures: gastric lavage by activated charcoal if patient come within 1 hour, and specific treatment: injection acetylcysteine IV, which increase glutathione, and it should be given within 8 hours of ingestion of paracetamol. And side effect of acetylcysteine is anaphylaxis. Liver transplantation may be done in case of life-threatening liver failure. So we have completed 5 questions on poisoning. Now 5 questions on genetic disease. Name 4 common genetic diseases: familial hypercholesteremia, adult polycystic kidney disease, Marfan syndrome, Ehlers-Danlos syndrome. Mention 4 methods used in prenatal test. Ultrasonography is done in first trimester to detect congenital heart disease, and chorionic villi biopsy for early chromosomal analysis. Amniotic fluid study for alpha-fetoprotein analysis for neural tube defect, done in second trimester, and chordosynthesis also done in second trimester, and it is done for chromosomal and DNA study. Mention 4 causes of secondary immune deficiency. These causes of secondary immune deficiency are diabetes mellitus, HIV infection, steroid therapy, malignant disease, and immunosuppressive drug therapy. Question number 2. Write down the characters of the autosomal dominant disease. Both male and females are equally affected. 50% offspring will be affected. 50% offspring of the affected parents will be affected and 50% normal. And disease is expressed in heterozygous parents. Mutation occurs in structural genetic protein. Mention 4 examples of autosomal dominant disease: familial hypercholesteremia, neurofibromatosis, adult polycystic kidney disease, Marfan syndrome. Mention 4 investigation of this disease. One is ultrasonography, which is done in first trimester to detect congenital heart disease. Second is chorionic biopsy. It is also done in first trimester for chromosomal analysis, and amino synthesis for study of the alpha-fetoprotein to detect neural tube defect in second trimester, and Corder synthesis in second trimester for chromosomal study. Question number 3. Write short note on genetic counseling. Genetic counseling provides information about medical and family affairs of a specific disease. It provides information about medical and family affairs of a specific disease in clear, non-directive manner. It helps individual to make informed decision. It helps individual to make informed decision about plan of family taking part in screening. It helps individual to make informed decision about plan of family taking part in screening. Write short note on the autosomal recessive disorders. It is a variety of genetic disease and it is characterized by both male and female are equally affected. Disease is expressed in homozygous state, and 50% offspring of the affected parents will be carrier and 25% will be affected, only 25% will be normal. An enzymatic protein gene is affected. Write short note on immunological tolerance. Immunological tolerance means it is the process by which body immune system recognizes and accepts self-tissue. It is the process by which body immune system recognizes the self-tissue. Now question number 4. A 25 years old, short, statured lady having history of primary amenorrhea. On examination, she has OF neck, pulse 90 beats per minute, and there is radiofemoral delay. What is your diagnosis? And what is the cause of radiofemoral delay in this patient? Diagnosis is Turner syndrome, and the cause of radiofemoral delay is coarctation of the aorta. And second question, write the genotype of this disorder. The genotype of this disorder is 45X0 chromosome. 45X0 chromosome. Question number 3, how will you confirm the genotype? It is confirmed by karyotyping. It is confirmed by karyotyping. Mention the principle of diagnosis of this disease. Principle of diagnosis. Diagnosis depends on clinical presentation and prenatal testing. And the clinical presentation are short stature, fish-like mouth, coarctation of the aorta, waving of the neck, and wide spaced nipple. Prenatal testing. Ultrasonography can detect Turner syndrome in first trimester. chorionic villi biopsy for early chromosomal analysis, chordosynthesis also for chromosomal study, and chordosynthesis done in second trimester. Now the last question of chromosomal disease. A 12 years lady was a 12 years a 12 years a 12 years girl was admitted with anemia and history of recurrent blood transfusion. On examination, she had splenomegaly, but no bony tenderness, and her parents has consanguineous marriage. What is your diagnosis? Diagnosis is thalassemia major. What type of genetic disorder it is? It is a autosomal recessive disorder. What are the characters of this type of disease? The characters of the autosomal recessive disorders are male and female are equally affected. Disease is expressed in homozygous state, and 50% offspring of affected parents will be carrier, and 25% will be affected, and 25% will be normal. An enzymatic protein and gene is defective. How will confirm this disease? Conformity investigation or prenatal testing like chorionic villi biopsy, amidosynthesis, chordosynthesis, and genetic counseling. So this is the end of today's class, and with this class, our class, especially medicine, is held up to 31st May for Eid vacation, and after Eid vacation we will try to continue class. And at the end of my discussion, I again pray to Almighty God for healthy life of my students and God's blessing for them so that they can continue their study and take preparation for next examination. So thank you all.